So what is the composition of this subretinal fluid? What do you think it contains?
We don't know actually, but
it's obviously a difficult area.
It's possibly it's the result of low-grade production of VEGF that could be a good thing for the photoreceptor. I think it's all a matter of quantity. If you are maybe if the VEGF is if you are a big amount of VEGF, the lesion is very active and get worse. But if the VEGF is produced, we know that VEGF is a physiologic protein involved in the photoreceptor survival and for the RPE survival. So possibly that fluid is the consequence of low-grade VEGF production by the RPE that definitely help the photoreceptor survival. And it's an emerging finding. We are not the first, but it's an emerging finding in the literature, and it's very interesting.
So what are your next steps with this research?
So next step will be to look at this material and 1 year, possibly 2 years after anti-VEGF treatment, and see if this material correlates with fibrosis or RPE atrophy.
Is there anything else you'd like to tell us about your research program and the activities at your university in this area?
Yeah, my research program is focused on the moment on the OCT findings and on the multimodal imaging, and therefore is focused on early detection of neovascular AMD and risk factors for development of neovascular age-related macular degeneration. And it's very interesting because there is a terrific increase of knowledge, and a lot of people is working on this, and it's very exciting because every day comes out something of interesting, and so new idea come out every day, and it's a very interesting topic. I'm very confident there is a lot to do.
And then finally, if you were to tell patients right now, what are the implications of this particular line of research for them? In simple terms, the protocols that you're developing, the screening programs you're developing, what will this mean for them in terms of treatment options? Or part of their treatment plan? In other words, will this become a standard tool that ophthalmologists will use when they go and see them in the office? Or will this largely be a research tool?
I don't think it's a matter of treatment options, because at the moment there is no way the anti-VEGF treatment is without any doubt the first line and the most effective treatment for neovascular AMD. But again, the early recognition of process related on neovascular AMD can get the patients to have an early treatment, and the sooner we treat them, the better will be the results for them.
Yeah, that answers my question.
Yeah.
Just what we're looking for is something to tell patients in terms of the implications for the way in which they're going to be treated.
Exactly. The morphology of this material tell us that the lesion, the disease is in the early process. So that means that treatment can work. Right. So we can tell the patients, okay, the treatment is going to work. Okay, it's not the only finding, the only thing we look at, but it's a finding that can add important information about the degree of activity of the lesion, and therefore we can is an additional information about the likely response to the treatment, so we can be maybe more precise about the.
I think that's a very powerful piece of information.
Yeah.
Dr. Casalino, thank you so much for joining us and explaining this very important area, and we look forward to watching your progress and reporting on your next steps next year at the same time.
Thank you very much for having me.
Thank you.